Start allowing everyone into the room, please.
Along with its national partners, are incredibly pleased to targeted health. These health hours, educating and giving space to our health hours cover a range of health, reproductive and sexual health issues, men's health problems, blended that can go hand in hand, health problems and influence response and well-being needs. The sessions are designed for you. The time. This during the needs of our Black community to request any particular topic.
Over to you, Dr. Joe.
Yeah. Thank you. Well, good morning, everybody, and thank you for joining us this lovely Saturday morning. My name is Osage Joseph Omafuma. We'll be sitting in as your host this morning. It's a slightly different position to be in, being on the other side of the camera this time, but I'm sure we are going to have a lovely, lovely, lovely time. So the Caribbean and African Targeted Health Improvement Program is in partnership with RAFA, BHI, RCCG, the Royal Assembly Sheffield, CBME, and ECA, as well as Croydon BME. So we've got lots of lovely partners who are making it possible for us to have these sessions. And these sessions are your sessions. These sessions are educational sessions aimed at the community to help us in our health improvement. And so we've got lots of colleagues who come on board from time to time, who volunteer their time, their skills, and their expertise to help us to move further. So we would encourage you today, if you have questions, queries, if you have comments, please put them in the comment section. If you're watching on YouTube, please do so as well. Normally the sessions, the presenter presents for about 20 to 25 minutes. And after that, we have a Q&A session. The Q&A session is really important because it helps to clarify any questions or issues that you may have. So it's quite interactive and would encourage you to be a part of it. If you are really pressed and you want to speak, please put your hand up and the admin will let us know so we can do that. So you're welcome this morning. These sessions have been running for quite some time, especially around the time of the pandemic. And this is just really for us to educate ourselves as a community and to become better at identifying and spotting our health needs so that we can cater for those in need. Today, I have an esteemed colleague who will be presenting to us. He's an experienced GP all the way from Leeds. He has a special interest in lots of vascular issues, but overall, his interest in the overall well-being of us as human beings. And today he'll be speaking along those lines with particular emphasis on beating erectile dysfunction, but having a look at your overall health. This particular topic can be quite difficult for people to discuss. It's something that sometimes people struggle with, both male and female, to broach the subject. And I'm sure by the time our speaker finishes today, we will have had much more understanding about this topic, how to identify it, what to look out for, and how to get help with it. So without further ado, I'd like to introduce our speaker for today, Dr. Abiye Hector-Goma. Thank you for joining us.
Thanks, Joe. And I want to thank the Caribbean and African Health Network for asking me to be part of this health hour again. Right, so let's get started. So I want to call this erectile dysfunction, getting up and staying up. And as Joe said, Hector-Goma, Abiye Hector-Goma, I'm a GP at Allerton and the Westfield Medical Centers in Leeds. I was looking for something around the topic, and I saw this at www.quora.com. It says a man has two brains, the one on his head and the one between his legs. And both them can't function at the same time. I have some reflections on this sentence, and maybe at the end of the day, we'll come back to it and see whether it makes sense or not. So this ROYGBIV, the mnemonic for the 7 colors of the rainbow, right? Reminds me of the verse, I have set my bow in the cloud, and it shall be a sign of the covenant between me and the earth. And I've also spent some time trying to understand erectile dysfunction, and I thought this this diagram from How Stuff Works, looking at the plumbing of a bathroom, makes me kind of understand where things can go wrong when we have water not running from the tap or where there's a blockage. This diagram gives one an idea of what has gone wrong or what could go wrong. So today we'll start by looking at what is erectile function. Erectile function is the ability to get and keep an erection firm enough for sex. And the opposite is erectile dysfunction, which is the inability to get and keep an erection firm enough for sex. And we'll start by having a kind of a very quick understanding of the anatomy. You can see here you have what are called the corpora cavernosa. The corpus means the main body, cavernosum is kind of cave-like structures, which forms the body of the penis. And you can see the blue is the vein, the red is the artery, and the yellow, the nerves. And these together form the orchestra of erection. Where there's a problem with the nerve, the artery, or the vein, then you have a flaccid penis. And then on this side, you can see the hollow structure here is the artery, and then you have this is a spongy area. So when there is erection, blood flows in here and it gets congested. We'll see that in 1 minute. Now, erectile dysfunction is a clinical problem that is underdiagnosed for obvious reasons. Men don't talk about it. They rarely come out and mention it even in consultations. It is under-evaluated and is also under-treated. It's a complex problem because it's just a complex problem anyway. And I wanted to use the same example here. If you look at the sink in the bathroom or in the kitchen, here you don't have the sieve here. So if you open the tap, the water will just pour. While here, if you put the sieve and pressed it down, if you open the tap, the water would just continue to rise. It won't go through and to the drain. And that's the way to have a look at erection sometimes. If blood flows and the veins are open, then the penis remains flaccid. But if the blood flows and the arteries and the corpus cavernosa, as it's called, gets engorged, and that blocks the exit pathway for the blood, then there is an erection which is sustained. So somewhere along the line, either proactively or in the course of a consultation, many chronic or long-term conditions were expected as clinicians to ask men if they have any problems getting it up and or keeping it up. So perhaps when we ask that question, a man can open up to us, or a man is encouraged by his partner or by himself to come and do a presentation about problems down below. So when we have a patient who comes and makes that kind of complaint, we get to ask a few questions which kind of try to do justice to where exactly this problem is coming from. We may ask questions about your physical well-being around exercise, if you have any long-term conditions, LTCs, if you have any lower urinary tract symptoms, if you've had any previous surgery down below, or you've had maybe cancer, you had radiotherapy, any lumps or bumps, or any issues with retraction of the glands of the penis. And then if the clinician wants to dive a bit deeper, you could ask about your finance, where you're in debt, because this kind of thing can cause emotional issues, can cause problems down below. And then look at the mental health, stress, depression, anxiety, sleep problems, anger problems, and also maybe look at your social environment, most importantly, your relationship with your partner, family and friends, how things are at work, what it's like living. You do have lovely neighbors or neighbors from hell. Ask whether you smoke, whether you drink alcohol, and whether you drink within reasonable limits of so-called 14 units or less, or you drink hazardously, whether you use recreational drugs or you buy things online or over the counter, you taking any supplements. And these kind of questions help us to kind of nail it down to know where exactly problems that may result in erectile dysfunction are happening around you. So there are specific questions about erectile function. One is your libido, your desire for sex. And we know that people who have low testosterone levels, or people who are going through significant emotional issues, may have reduced libido. So your desire for sex is one question. And how satisfied are you with your erection? Any issues with ejaculation? How are you satisfied with intercourse? And how are you overall? What is your overall satisfaction? So these are 5 questions that are key. And you have the IIEF 5 or IIEF 15 questions, index of erectile function. So if you Googled IIEF 5, or if you actually went to Apple Store or the Google Store, there is actually, you can actually download and do this calculation. And the answer you get, you either get normal, mild, moderate, or severe erectile dysfunction. So feel free to do that. There's a calculation here, but if you just do IIEF 5, and then you can just check your score as a man, and that gives you an idea. That's an action point we'll come back to, but this is something that you can do. You can straight away know whether your erectile overall satisfaction is great, mild, moderate, or severe erectile dysfunction. Then your clinician may go ahead to do a physical examination, check your pulses, particularly around the groin area, check the pulses in your wrist around the groin, check your blood pressure, have a listen to your heart, and depending on the story you've given, maybe examine your penis and your testes, and based on age, and if you have lower urinary tract symptoms, may go ahead to check your prostate by doing a rectal examination, and may also check your urine for in case there's blood, protein, glucose, or anything else. So that's what we will do. And after that, the next option is that depending on what symptoms you presented, we may ask do a lab test, or we may go ahead and look at management options. Everything, lifestyle counseling is definitely number one, looking at your lifestyle and looking at areas where you can make a difference. And if need be, depending on what your history and the findings are, maybe refer you on to a urologist for more expert. It's a very busy slide, but I'm just going to mention that I used the 7 colors of the rainbow to look at 7 different areas: the brain, the spinal cord, the nerve endings, the blood vessels lining, the penile artery, the muscles of the penis, the veins of the penis. These are all 7 different areas where a problem one or more problems can occur with erection. And that's what I was saying, it's a complex problem. But there are about at least 7 different points where you could have an issue. Let me just go on to the next slide. Now, it said logic will take you from point A to point B, but Albert Einstein said imagination will take you everywhere. And the start of erection has to do with the brain. So what you see, so visual, the touch, the scent of a woman, as Al Pacino, we all know him about. These 4 things, your imagination, your visuals, your tactile, your olfactory senses, all these come together and begin the process of erection. Now, issues like depression, anxiety, relationship conflicts, stress at home, at work, stress from social, cultural, or religious conflicts, and worry about sex performance, these can all dampen this critical first phase of erection. And of course, this is again a very complex diagram. Apologies for that, but again, just to let you know that at the next level of the spinal cord, things can go wrong. And I just used the Jamaican 4x100 meters photograph to say, you can see impulses coming from the brain pass from one to the other. And where that passage, like a baton exchange, there's a problem with the baton exchange, then the sensation will not be transmitted from the brain to the penis. So why do men have erectile dysfunction? As men grow older, they are more likely to have erectile dysfunction, which it doesn't follow. You can still have virile men in their 80s, but generally, as men grow older, they are more likely to have erectile dysfunction. So diabetes, hypertension, cardiovascular disease, very high cholesterol, men who smoke. We, as clinicians, quite a few of the drugs that we give to patients can cause erectile dysfunction. And people who take drugs, illicit drugs, heroin, cannabis, obesity, lack of exercise, can all contribute to erectile dysfunction. I've tried to break it down into different parts. So the arteries can become narrow, and that's when I use the example of the tap flowing. If the tap is full of stuff, when you open the tap, like your shower sometimes, when you have bits in the shower head, when you open the shower, you can see that the water doesn't flow with the kind of jet stream you want to see. So when the arteries have plaques in them, you can find this with hypertension, it's poorly managed, diabetes, heart disease, smoking, and in people who are living with obesity, you can have narrowing of the arteries. Now, it's important to note, I put IHD with asterisks here, that erectile dysfunction, it's a very early sign for heart disease. So if you don't remember anything I say today, remember that as a man, if you have erectile dysfunction, that is a warning sign that you may have heart disease in the near future. And that gives you a good enough reason to see your clinician for review. There are problems with the nerves from the brain, the spinal cord, the nerves themselves, from injury, from diabetes again, from multiple sclerosis, Parkinson's disease, or stroke. This can have an effect on the functioning of the nerves. And then hormones such as testosterone, the thyroid, cortisol have an effect on testosterone, for example, has both central and peripheral effects on the erectile process. And then psychological causes, well, the most important one being performance anxiety, either in a new relationship or you've had a performance which was subpar, you now become anxious about what the next one will be like. So anxiety, stress, and depression, the same relationship conflicts can all reduce sexual libido, reduce libido are some of the psychological factors. And then I've put other factors. Just 1 minute. So I put other factors such as your lifestyle, the medicines that your clinician may prescribe for you, problems with the penis, such as what is called Peyronie's disease, where you have some lumps or curvatures of the penis, a very tight frenulum, that is the skin of the penis can be very tightly bound, and that can cause pain or difficulty with some people in erection. There are thoughts about some of the pesticides that are used in the environment. A gene have been associated with erectile dysfunction. It's called SIM1. And then I mentioned age. As we grow older, the nerves and the cells that line in blood vessel may not function properly. So for the younger men, remember that your nerves are probably most likely to be in good shape. Your blood vessels are also likely to be in good shape. So for the younger men, it's probably all in the head. Performance anxiety, it's the real problem. But for every one of us, I think the 6 areas to improve our health, which we talk about virtually in every condition, whether it's diabetes, heart disease, hypertension, whatever long-term condition that we have, the key areas are healthy eating of whole plant-based food, to increase our physical activity, to develop strategies to manage stress, to form and maintain excellent relationships, to improve our sleep, and to avoid risky substances like alcohol, cigarettes, and so on. So those 6 lifestyle interventions are always the same for any long-term condition, including erectile dysfunction. So how do you treat erectile dysfunction? As we mentioned, we have to identify the risk factors of cardiovascular disease. Because the blood vessels get narrow, blood flow to the penis is reduced. So we need to do our best to tackle the risk factors of hypertension, diabetes, heart disease, chronic kidney disease, high cholesterol, as well as the medication that we prescribe for our patients. So as a patient, if you're on any medicines and erectile dysfunction has started not long after taking this medicine, have a read of the side effects and maybe talk to your clinician about if the medicine is possibly responsible for the erectile dysfunction. And then if it is stress, anxiety, depression, relationship issues, then psychological interventions or medication linked to improving anxiety and depression may have a knock-on effect on improving erectile function. So I've again tried to look at the various forms of treatment that are available, where the problem is largely the mind, then behavioral interventions such as psychosexual treatment, cognitive behavioral therapy, anything around improving the mind, making the mind happy. Without those photos I showed you about eyes, touch, and imagination and smell. So when you improve the function of the brain, a happier brain will almost always translate into improved erectile function. And then we talk about medication. And of course, we all know the wonder drug and the blue pill Viagra, which is a phosphodiesterase type 5 inhibitor. As we all know the story, Viagra was initially made as a blood pressure medication, and during the trials, the men all came back. Many of them came back with wide smiles to the research clinicians, only to find out then that there was a better market for Viagra than treating blood pressure. And Pfizer stock value just went into the stratosphere. So if those who have low testosterone, the endocrinologists can start testosterone therapy. The other options, such as penile injections, medication straight into the urethra, and things such as regenerative therapeutics are things that you talk about at specialist level. And then a review of medication would always help to see if, so sometimes we are over treating patients, and medication review can be a big difference in erectile function. There are lots of herbal options, throughout history. Various herbs have been used by various cultures to try and improve performance. And I don't know much about those details, but you can see that there are over 317 listed antioxidant potentials. And anything that can reduce the level of oxidants in the body can have a positive effect on erection. And then from a surgical point of view, penile implants, vacuum erection devices, and rarely, if a young person has had trauma to the pelvic area, which has affected the blood vessels, then surgery can be done to try to bypass or correct the vascular problem there. So that's the penile implant. I haven't seen one before in action, but penile implant. And this is the vacuum erectile dysfunction vacuum. Again, these are things that are done at the level of the urologist. So call to action: do you have erectile dysfunction? You have three answers: yes, don't know, or no. If you have erectile dysfunction, self-help is important. Read about it, lifestyle modification, and where you're giving medication, be compliant with it. If you haven't gone to see anybody, then seek help. Come to us, see your GP, and if need be, we'll refer you to a urologist. If you don't know, like I mentioned, just Google IIEF-5 and check your score, and that will let you know where things are. And if your score shows that you have erectile dysfunction, you can decide again read about it, lifestyle modification, and then again book an appointment. If your score is excellent, you don't have erectile dysfunction, fantastic. Continue to maintain a healthy lifestyle so that you don't need our services tomorrow. So taking action, self-help, as I mentioned, is important. And for those who have issues around their mind or where there are relationship problems, then psychosexual therapy is advisable. And then lifestyle modification for everyone, whether you don't know, or you don't have erectile dysfunction, lifestyle modification is important. Remember, when you have an erection, you're going to do some exercise. You hear of men who are in a hotel room and they've taken various things, aphrodisiacs, herbals, or internet drugs, and their heart stopped beating. So you're going to do exercise in bed. Make sure that you're doing exercise with your feet first before you go down doing exercise in bed. Healthy eating is important. As always, healthy eating will help to protect the nerves, the arteries. And then if you're on various medications, have a medication review of your prescribed drugs, and long-term condition reviews. It's always important if you're living with long-term conditions, diabetes, hypertension, heart disease, stroke, whatever, when you're having a long-term condition review, if your clinician does not ask you, you should tell them if you're having erectile dysfunction, because they can now have a look at the medicines that you're taking, look through all of this, and then decide whatever else you require. And then medical devices, as I mentioned, perhaps when you get to see, if you get to see a urologist, then those device options can be. So in summary, you have erectile dysfunction, trouble getting an erection, trouble keeping it up long enough, reduce sexual desire, and the causes we talked about: aging, diabetes is an important one that affects the nerves, that affects the arteries, hypertension, heart disease, cigarette smoking, various medicines, low levels of testosterone, alcohol beyond sensible limits, nerve or spinal cord damage, and stress. These are the key causes of erectile dysfunction. And the lifestyle changes of maintaining a healthy body weight, as they say, every little helps, quitting smoking, limiting or stopping alcohol, more physical activity, and stress management will always help to improve erectile dysfunction. So what's the outcome of erectile dysfunction? As we know, stress, loss of confidence, relationship problems, and most importantly, erectile dysfunction could be the first awareness that a heart problem is going to be coming your way in future if you don't do anything about it. Thank you for listening, and I'll be here to take your questions. But let me just end by, if I can show this little small video while I hand you over to the moderator. Just give me a few more seconds. If it doesn't come on, then we'll skip it. Or it did. That's the man who has no erectile dysfunction. The blood is flowing, and you can feel as the blood is flowing, erectile very well. And if you look at erectile dysfunction here, even with a stopper preventing the veins from losing no man will be happy if this is what he gets at the end of the day. So remember, lifestyle modification, talk to us, and we'll try and put a smile back on your face. Thanks for listening.
Thank you, Dr. Hector, for that very comprehensive presentation. I must say, you managed to pack quite a lot into 25 minutes. That's quite a lot of information to take in. Thank you so much for that. I didn't get to see the video at the end. I don't know if it was from my end, but
I think it was my end. I think I should have shared the video separately. Yeah.
Right. Okay. Perhaps we'll take a look at it some other time. But yeah, lovely discussion. Now, I must say that I don't know what your experience has been in terms of men coming in, but most men don't like talking about erectile dysfunction. Usually they're either prompted by their partners or when the relationship is about to break down. How do we, A, encourage men to come forward, and B, how do you coax it out of them in that conversation? How do you sort of get them to begin to really open up about it?
Yeah, from our point of view as clinicians, particularly, I mean, for example, if we're doing a diabetes review for a man, you must ask the question, do you have erectile dysfunction? So as clinicians, we need to be proactive about asking the question, do you have any concerns down below? That's one. And like you said, it's very rare. It's a man's pride, isn't it? It's very rare for a man to come out to say he has erectile dysfunction. I think the other thing is that a men's group, it's something that makes a lot of difference. If you have, for example, if I had a session with men in Leeds or something, and I asked that question, we would have a healthy conversation. And then this IIEF5 is something that everybody can do. Just check it and see what your score is. Yeah. And then if your score is elevated, definitely most GP practices would have a male GP. And then you could just ask specifically you want to speak to a man, and every GP practice would honor that request. So it's very challenging, it's difficult, but we as clinicians should be proactive, particularly with long-term condition reviews. And then maybe men's health sessions would make a difference. And then everybody should check their score. And then from there, look for a male doctor to talk to.
That's great. Thank you. Let me just say to everyone that if you have questions, comments, please type them in the comment box and we'll try and accommodate as many questions as possible. Now, I'm going to be a little bit cheeky and sort of draw you into a men's world for a few minutes, because I had a gentleman who complained in inverted commas that he could only have sex once a week with his partner. And so how much is too much or how much is too little in terms of sexual activity for a man? What should we consider to be normal?
Well, I think it's the question, how long is a piece of string? It depends. It depends on a few factors. One is what has been normal for the man. It takes two to tango. You know, sometimes many of our partners are overworked.
Mm.
And if you want to make love to a woman, you start from the break of dawn to begin to get her in the mood, whatever it is. So those are the kind of challenges I would have. That it's a two-way stream. In some homes, again, where you have young children in the house, there may be issues of that nature. So there is no fixed amount, whether it's once a week or twice a week or every day or once a month, depends on what is normal for that couple.
Okay. So you heard it from the doctor himself. It's as long as a piece of string, and it depends on how far you want to stretch that spring. Please, can I take this recording and show it to my wife? All right.
I mean, there was this, sorry, just to digress, there was this research in quotes which said that men who have sex 5 times a week are less likely to have prostate cancer. A man took it to his wife and she said, "Welcome to prostate cancer."
That's a good one. I saw something similar. And the woman said, "Better start getting ready for chemotherapy because you're definitely getting prostate cancer at this rate." So on the more serious, there's a couple of things that I want to highlight. So I know this talk is mainly about men's health, but are there some things that can affect female libido? Apart from the emotional aspect that you already alluded to, are there certain things that can affect female libido? And how can a woman help or her partner who is struggling with erectile dysfunction? The double barrel question there.
Yes, I mean, similar to the menopause also takes place. So one is women who are going through the change. One of the problems is loss of libido. Is one thing. With loss of libido, sometimes cause vaginal dryness. And so if a man before now had a partner who's very active and then suddenly she loses interest, and every time he comes near her, she gives excuses and all of that, that can also cause, ED can cause relationship problems coming from the man. The loss of interest from the woman can also cause relationship problems. And then beyond the organic bit is that this partner goes to work and people have challenges in the workplace. You may have children who are adolescents going to adolescent crisis. That brings family challenges. You might even be your father-in-law, your mother-in-law is very ill. That has a massive effect on your partner. The last thing on her mind is sex. So all those can have an impact on the man himself coming from the woman.
Mm-hmm. That's really good. So you've highlighted something that is very close to my heart, because one of my main special interest is mental health. And I was looking at the psychological, how important is the psychological aspect of the causative, pattern for erectile dysfunction? How important is stress and the mental aspect of it?
Very good question. I always like to look at things. I want to understand what happens at the cellular level, at the kind of the fundamental kind of the foundation of a problem. And like I said, erection begins in the brain. That's where erection begins. And then from the brain, it goes via the spinal cord down to the nerve endings, to the endothelial cells. And then I didn't even talk about that. Nitrous oxide is released, which now, I didn't go to that whole thing. I hit that slide. But so because it begins in the brain, the sight, the smell, the thought, the imagination, when those things are affected by psychological situation, that could just be a barrier to initiating that first phase of erection. And that's where anxiety, stress, psychological problems can have a massive effect on someone that has financial problems, for example, can just completely lose interest in sex. And when the financial problem is sorted, the person has a style on all overnight. So yes, psychological problems have a massive effect on erection.
Okay, that's interesting. So somebody is pointing me back to, I asked a double barrel question, but I think you only answered one. Right. Angela has made a comment here that unfortunately men are more reluctant to go to the GP, and often they suffer in silence, exacerbating the problem. So I was asking, if your partner is struggling with erectile dysfunction, as a partner, as a woman, or how do you help, or how can you assist your partner in this issue? Or what are the tips that you can give us?
Well, the first one is bibliotherapy, is to read about it. I mean, everything I've said today is available online. So websites like Patient Info, there's the British Urology Association. There are quite some simple things. So first of all, look at the risk.
But you know, there's a lot of, sorry to interrupt, there's a lot of rubbish online as well.
Yes, definitely. That's why I said specifically.
Somebody sent me an email and said, WhatsApp, I said, drink a lot of ginger. That was my next question. Drink a lot of ginger, eat red carrots, your erection will always be this. Sorry, I'll allow you to answer this question, but the next question is, what are some of the natural things that we can have, from a practical level? Many of us, especially the Afro-Caribbean, but most men they don't like taking medication. And most men, like somebody alluded to, will not go to the doctors to get checked out. We feel we are macho, there's nothing that can be wrong with us. Sometimes we're busy, people are struggling or hustling, as the case may be, trying to make ends meet. People have 2 jobs. So what are some of the natural things that, if you answer, once you finish with the first question, the next question, what are some of the natural things that we can do to enhance, or to prevent erectile dysfunction, as it were?
Okay. So, the first thing is to have a supportive partner, as they call it, a helpmate. So a supportive partner would come alongside her partner, kind of some people would just say, you call yourself a man, you can't even perform. As against, darling, I understand that there are quite a few challenges. You have all these problems at work, and sometimes all these kind of pressures can have an impact on sexual performance. So don't worry about it. Let's have a look at this. So by reading like I said, going to patient.info or some of the medical websites of repute, you can see what changes you can make at home. So maybe you have a financial problem, maybe having a look at your finances, maybe one of them. So have a look at what you can do together at home to make things different. Maybe you're overdue for a holiday, you've not been on holiday, say, can we take a weekend break or something? But then there may be something else, maybe it's diabetic or it has blood pressure not well controlled, then encourage him to go and see the doctor. Sometimes men come to me and they say, oh, I'm here because my wife asked me to come. I say, good man. That when you do as you're told, you're a happy man. So sometimes you have to book the appointment for him and even drive him down to the place and wait for him in the waiting room. So, do you want to come with you? He might come into the room and say nothing and all of that. But I would say in a supportive way, you can get your man to come. Most men do as they are told. So in a supportive way, you can drag him to the GP and then tell him to come and see us. So one is what you can do at home. Look at the lifestyle issues. Maybe go walking together. Then get him to come and see the GP in a supportive, nice way, as against you can't even do stuff.
So that's really important. Sorry, I wanted to tease that out from you, because what my observation as a clinician as well is that once erectile dysfunction sets in, unfortunately, either due to lack of education or lack of exposure, or due to relationship tension already, most women are not very understanding. Is it possible that you can have, and I think you've already alluded to this, is it possible to have temporary periods where there are erectile dysfunction and then you can get, relieved without taking any medication or needing any treatment? Does that happen?
Well, somebody has just asked that question, which is what you've just said, that if there are psychological factors, can it resolve without intervention when the stress passes? The answer is yes, it can. That if somebody, for example, had issues at work, maybe somebody that accused you of doing something at work, at the end of 3-6 months of investigations, you were found, not guilty and apologies were made, a weight is lifted off your shoulders. And the next thing is that you suddenly find out that you are having an early morning tunic and say, oh yeah, so you were there all the while, the sun never stopped shining. So yes, it is possible. But the other point is that if there have been psychological factors and those factors have caused you to lose your confidence, even when they've gone, it might take a while before it comes back, but definitely it will come back as long as you take the right. If it doesn't come back naturally, then maybe psychosexual counseling or therapy would help. But unlike things like damage to nerves, blocked artery, which may be permanent, psychological factors which are lifted, erectile function can and should come back.
Okay, so just going back to the natural
Yes.
Products and things. So I'm particularly interested in what kind of products or remedies can, let's just say foods to start with. And are there some things that you can actually take that can be harmful to you in terms of erectile dysfunction?
Well, that's a good question. I don't have much experience in this, but I know that one of the slides I showed you, I was looking at a research work where about 370 papers were looked at around phytomedicinal interventions in erectile dysfunction. And you are well cataloged in that paper. There are at least 40 different things from Chinese to Indian to African herbal remedies which help erectile dysfunction. In fact, it's a story that I can tell another day around. There's a lady back in Port Harcourt who has a massive market, that's in River State. She uses herbs, and you have men queuing from Jericho to Jerusalem to try and get this herbal thing that she does. So definitely there are things, and when you look at it, when you look at the chemistry, you have nitrous oxide is the key chemical which leads to, sorry, I didn't show that slide. Nitrous oxide is released, which causes the blood vessels to open up, which increases blood flow through the penile arteries. The other thing is that it also causes relaxation of the muscles of the penis, so that when they are relaxed, more blood flows in there. So there are herbs. I mean, ginger was mentioned, and there are quite a few in the paper. I don't have the details because I don't have much experience, but there are definitely herbs which have an impact on the nitrous oxide production, both at the level of the nerves and at the level of the endothelial cells, the cells of the blood vessel. There are herbs which increase I wish I showed that diagram, but nitrous oxide leads to an increase. There's a cascade, and it leads to an increase in a particular chemical, which causes calcium level within the cells to be reduced. And when calcium within the cells are reduced, it causes the muscles to relax. So definitely there are many herbs which can cause increased nitric oxide, as well as cause a reduction in calcium within the cells, thereby increasing blood flow and keeping the muscles relaxed to increase blood flow and retention in the penis. So definitely there are herbs, but again, unless people do research and find out what are those active ingredients, is a bit difficult. But the truth is that aphrodisiacs work on this principle of increasing nitric oxide as well as reducing calcium in the muscles of the penis.
Thank you for that, Doc. I'm going to put you on the spot for a couple of seconds here.
All right.
I have some colleagues who swear by the fact that the Chinese have done this for years, millions and millions, thousands and thousands of years. They swear by the fact that red ginseng, or ginseng generally, which the Chinese put a lot in their product, as aphrodisiac. Does it really work? And do you know of any side effects from excessive use, apart from priapism, which is excessive erection? Do you know of any side effect? Just very briefly, there's a couple of questions now coming up.
No, I don't have much knowledge about the health, but like I said earlier, that the pharmacodynamics is there to show that these things work.
Okay. Lovely. So there's this lovely question which I think we should look into. It says here that, thank you, Doc, for this presentation, which has been interesting so far. You mentioned mental health and erectile dysfunction, and there's some information out there that indicate that this problem is more common in Black men. How true is this? And if so, is this linked to mental stressors? Is it true? Is it true that it's more common in Black men?
Well, it's more common in Black men because the mental health problems are commoner in Black men, in the sense that the Black man, not the Black man in Africa, but the Black man in UK is at a disadvantage to his Caucasian colleague for obvious reasons. So whether you're going to get a mortgage, you're going to get a job, you're going for an interview, things are stepped up against you. And then the black man maybe has his nuclear family, the extended family in the UK, the extended family abroad, and you're busy working around the clock trying to sort out 1 million people, while your Caucasian friend may just be me, myself, and I. So when you look at that, the challenges are a lot more for the man of African descent. Then in terms of accessing care for physical problem, again, the man of African descent may be less likely to come and see his GP or whatever, and even when he comes up, he's more likely to feel unwanted in the place. Yeah. And he stays there. We say all these things can now make the black man more likely to have polycontrolled diabetes and all of that. So yes, and these things all add up to having a higher mental health problem, which is caused by the system. And of course, from what we said, the brain has a massive effect on ED. And if the black man is carrying all these things on his shoulders, if he has ED, is more likely to, even less likely to talk about it, more likely to carry it for a much longer time.
Fantastic. Thank you so much for that. Okay, so here is a really good question. You mentioned in your presentation about age and erectile dysfunction sort of dwindling with age. So there's two questions here. At what age should one begin to expect that one will expect some measure of erectile dysfunction? And then at what age do you assume that it's no longer possible? This is a question online, very interesting. I'd like to hear what your thoughts are.
Again, there is no age per se to say, but it is like somebody, I remember there was once in the UK, there was this 40% of men over 40 have erectile dysfunction. There was that kind of phrase that came up, and then it was discountenance. But as men grow older, definitely the problems of cardiovascular disease and all of those things, the long-term conditions are more likely as we grow older. And like I said, a few men up to over age 80 are still active. Men may have had prostate.
Yeah, but you know, Mandela up until the age of 80 was still active. So
exactly. Well, he probably is the exception and not the rule. So there is no right age.
Just chipping it in there.
I still have men who are in their 80s coming to ask for Viagra in my practice. So yes. So I think it's all individual dependent. A man who is fit, active, running regularly may still be in his 80s and being very active. So I don't think there's a particular age, but you would expect that testosterone levels begin to fall from our late 30s, I think.
Sure.
Testosterone has a massive effect both centrally and peripherally on erection. So yes, it's possible that from age 40 downhill begins, but it all depends on all the other factors the man has.
Thank you for that, Doc. You know, there's something you said that really was, and I think was really profound. Emotional well-being really, really has a massive effect on erectile dysfunction. I had a lovely couple. The husband was 82, the wife was 78, and they came to ask for performance enhancers, and they were both giggling like teenagers. Okay. And my first instinct was like, Grandpa, what are you doing? You know, but the truth of the matter is that because their relationship was solid and, you know, they wanted to be with each other, it was easier for them to, just like his body was letting him down. So the psychological aspect of erectile dysfunction is really, really important. A couple of quick questions here for you. Can wearing tight underwear and riding on bicycles cause erectile dysfunction?
Yes, actually, it's looking through, it said that if you don't have the proper saddle, you could have erectile dysfunction. Is possible amongst people who ride for up to 3 hours a week or something. That is a possibility that it can have an effect.
Okay. Another quick question here says, does an enlarged prostate contribute or cause erectile dysfunction?
I mean, yes, it does, in the sense that an enlarged prostate, that's why I talk about the lower urinary tract symptoms. When you have an enlarged prostate, you find out that you have symptoms all the time when you're weaning. And that could also have a knock-on effect, because if every time you're going to wee, there's a problem, then you can have a knock-on effect on sexual activity. And then the person who has enlarged prostate probably is the older man who is also more likely to have other long-term conditions, which can also contribute to reduced blood flow into the penis. So yes.
Let me sort of delve into, you mentioned about medication, and, you know, we know for a fact that certain blood pressure tablets can cause erectile dysfunction. Certain antidepressants can cause erectile dysfunction. should this be a reason, or should this be something that people will now say, well, because this causes this, I shouldn't be taking this medication? Or do you have some advice for anybody who may be experiencing those kind of situations? Even some people who are diabetic actually suffer with erectile dysfunction. How do you manage that when you have a comorbidity or something else that you may be dealing with?
Well, every blood pressure medication has erectile dysfunction as a possible side effect, but it does not mean that if you're on, say, an ACE inhibitor, you will have. So sometimes if, let's say, before you started a blood pressure tablet, everything was fine, then you are given a blood pressure tablet and suddenly erectile dysfunction becomes a problem, then you can go back to your doctor and the doctor could change to a different blood pressure tablet. Now, I was thinking about this question in the sense that if somebody had diabetes and is put on ACE inhibitors because their kidney is leaking protein, that medication is having a dual function. So it might be that taking him off that medication may not be the best. So you kind of weigh the pros and cons, but most times we'll try something else.
Okay. There's a link that's been posted in the chat if you require counseling at all for any condition, because we've been talking today about the fact that emotional and mental well-being plays a very important part in both our physical and our mental health. We have a dedicated counseling team here in CAHN, and there's a link here for you to get in touch with them. Please do so. They're the lovely team. I know them. They're there. If you email CAHNhealth@CAHN.org, you can get in touch with them, and you get in touch with the counseling helpline as well. It's being posted there. I think it's really important that one of the messages that the doctor is bringing out today is that people should not suffer in silence. Please seek help as soon as possible. There's a couple of questions here that I think we need to look at. Somebody is going back to an initial question that I sort of alluded to. Ideally, how long should sex naturally last for a man?
Okay.
There seems to be this promotion out there that a man who cannot last for a certain level of hours in bed, I don't know about hours, but hours in bed is not a man. This, I believe, is largely influenced by men eating and drinking. Well, this then leads to men drinking and eating all manner of things in order to be able to last long in bed. So how long ideally should a man naturally last?
Okay, I think I was looking at a document on the fourth consensus on sexual medicine. They said everybody agrees that less than 1 minute is premature ejaculation. Most people agree that less than 2 minutes is premature ejaculation. And anything from 2 minutes to 30 minutes is considered within the normal range. That's just what that document said.
So not hours then?
Well, maybe in planet Mars, I don't know.
No, because now I'm interested. How do you move? Is it necessary to have sex for hours and hours and hours? Does that improve relationship, or I don't know? Is that something that's considered healthy? Because like the question alluded to, there's a lot of information that sort of feeds into the fact that you have to be you have to be a stallion in bed, or you have to perform for hours, run an Olympic marathon in bed, that sort of thing, for you to be considered normal. And what would you say about that?
That's why I said that the sexual experts say that anything less than 1 minute is not normal. Most of them say anything less than 2 minutes is not normal, but between 2 and 30 minutes is considered normal. But I guess, again, like I mentioned, it takes 2 to tango. If your partner has an orgasm in 30 seconds or 1 minute or 2 minutes, that's fine. But if the key thing is that it depends, it's a two-way stream, isn't it? How well your partner is sexually stimulated and how well your partner is able to achieve sexual satisfaction is a measure. So whether you stay for 1 minute or stay for 1 hour, what happens with your partner? If your partner is satisfied, then whatever it takes to get there, I think that's what matters most, if you really want to give pleasure to your partner. But I would say that 2 to 30 minutes is considered a normal range. Anything above 30 minutes is going down the realms of, I guess, internet medications and what have you.
Is there such a thing as having too much sex?
Yes, there is.
Especially for a man.
There are pathological people who are considered nymphomaniacs or something. Those are people who have an undue drive for sexual activities. So definitely there is pathological desire for sex.
So what kind of side effects, or what can arise, or what are the things that can, what are the bad things that can come out from that?
Well, the point is that that person probably will not be able to get satisfaction from one partner. So he or she may just keep looking for more and more partners, and in that process can come down with sexually transmitted infections.
Okay, I mean, there's not enough time, but I wanted to ask you questions about premature ejaculation, about the role of STIs, or sexually transmitted infections, in how it affects how it affects erectile dysfunction. Can you quickly make a comment along those lines?
Well, in terms of PE, premature ejaculation, like we said, is anything less than 1 minute, it's considered premature ejaculation. And there are facts of premature ejaculation, either something that is been there from the person from day one, or something that comes in with particular situations. But I mean, there are two things. One is the so-called Masters and Johnson's technique, where there is a squeeze on the penis just to try and delay the feeling. And that can only happen with a partner who is like your lifelong partners against a casual relationship. And then, so generally psychosexual therapy on the NHS, there are 6 to 12 months wait for that. But one is to read about it, look at what you can do for yourself, and then see your GP, because there are some medications like SSRIs, which may not necessarily provide cure, but for some people, they are helpful. Very good.
Just a couple more questions along this line. There's something very intriguing question here. Going back to the challenges with engaging with GPs, about possible mental health and erectile dysfunction as a Black man or Black people. Does the NHS have a self-referral and free service for sexual health counseling?
I think different PCNs now, ICBs, may have different options. So it will be to find out.
Sorry, tell us what a PCN is.
Okay, sorry. Primary Care Network, or the latest one that's taken over from CCGs, ICBs. I don't know what it means really. Something care boards.
Integrated care boards, I think they're called.
So it depends on what is available. But I guess the first thing you would do is, if you just type NHS psychosexual counseling, then you can see whether it is a self-referral option or it is a GP referral option in your area. But definitely you have a department for psychosexual counseling. You know, and some of these things are also, some areas may have a computerized approach to it. So just check in your own area what's available. But there's definitely an NHS psychosexual counseling service, whether it is self-referral or via GPs, what I'm not sure for your area.
Brilliant, thank you. So it's quite localized, and it depends on what area you live in. So this is an important question. I was going to talk about cardiovascular effects, but someone's asking a question. You know, you've alluded to premature ejaculation as being an issue. Is there any cure for delayed ejaculation?
Yes, I mean, like, you have the reverse. People have that as a problem, and again, it's something that you'd have to speak to a clinician or a psychosexual therapist to find out what it is that is causing that.
So can drugs or medication cause delayed ejaculation? Definitely.
It's interesting that the reason why we use SSRIs in treating premature ejaculation is that they can cause delayed ejaculation. So for somebody who does not have premature ejaculation as a problem, when they're being given these medicines to treat depression or anxiety, they can result in delayed ejaculation. So you don't have a problem, it creates a new problem for you.
Fantastic. Okay. You mentioned about cardiovascular health and erectile dysfunction being one of the early signs for cardiovascular health. Can you just please talk a little bit more about this, and what should we be doing in terms of looking after our cardiovascular health to make sure that we keep that in top notch?
Okay, just to if you remember that you have the brain and then the nerves, and then at the end of the day, I talked about nitric oxide and reduced calcium, leading to opening up of the blood vessels so that blood can flow into the penis. Now, if the artery is narrowed by plaques in the wall of the penis, it means that the penile artery is not going to open up for blood to flow, even though the chemicals are there. And that is the same mechanism that you find in heart attacks and stroke. When you're doing exercise, the coronary arteries need to open up for blood to flow to the muscles of the heart. But if the arteries have plaques in them, they can't open up. So there's now pain because oxygen demand is increased. You can't get there. So likewise, when that happens with the penile artery, so you find yourself not being able to either have an erection or sustain it, that means that the penile artery is probably narrow. And that same thing could mean that the coronary artery to the heart is probably narrow, or the artery to the brain is probably narrow, which can be tomorrow's stroke or heart attack. So having erectile dysfunction is a warning sign that you could develop coronary artery disease tomorrow. And then lifestyle modifications, and it's the same lifestyle modification. If you're smoking, you have to stop smoking. If you eat like an African, you have to eat like a white man. You have to eat more of salads and cut back on eba. You know, you can eat your eba, but small portion size, you know, and all of that. Exercise is key. You know, sleeping is important. Having friends, having a good laugh is important. So those lifestyle risk factor modification, go and go for your health check your cholesterol level, check your glucose level, check your kidney function and liver function. If need be, go on a statin to reduce your risk of a stroke or heart attack in the next 10 years. So risk factor management is key to protecting your heart and being there to play with your grandchildren and staying there for with your loved ones for much longer.
Fantastic. So you mentioned a lot of things there, but I think the very last point is really pertinent. Anybody over the age of 35, I think every couple of years or so, if you don't have any underlying health conditions, you should go and get what is called a well man check or a well woman check with your GP. This will check your level of cholesterol. This will check if you have diabetes. And, you know, like the old saying says, prevention is better than cure. So it's better that when these things are picked up. You know, Hector mentioned about plaques. These plaques are caused by cholesterol, which has stayed very long in your system and then begin to clog up the arteries. So it's really important that when you do these health checks, the blood test that is done includes a cholesterol check, which then picks up this thing at an early point. And then you can have medication or you can have lifestyle modification that can actually help with that. So prevention is really better than cure in this case, and getting health checks. Because what we are finding, as you probably are aware, Hector, that a lot of times in the Afro-Caribbean community, we don't go for health checks. There are lots of access issues, be it language, you know, all sorts of things that cause barriers to accessing health. And this is one of the reasons why CAHN was set up in the first place, to help to bridge that gap and, you know, educate the population, educate the community, and provide a facility really for people to be able to access better health. One or two more questions before we round off today. Somebody is asking again about, do hemorrhoids affect a man's ability to perform in bed?
I mean, the answer is yes and no. I mean, you can have external hemorrhoids and internal hemorrhoids. If you have hemorrhoids which are painful, the rectum is very close to the penis anatomically. So if you have hemorrhoids which are causing you problem, the pain, the discomfort alone would have an impact on your sexual life. So definitely, if you have hemorrhoids which are well managed and they don't cause you problem, then that should be okay. But if they are thrombosed or they are prolapsed, then of course that awareness of something wrong just behind there. Again, the hemorrhoids are close to the prostate gland, which is part of the sexual family, as it were. So definitely, large hemorrhoids, complicated hemorrhoids will have a knock-on effect on sexual performance.
Thank you. So how true is it that when a young man isn't sexually active, over time, the sperm accumulates in his body and can cause him health problems? Is that true?
Well,
I'm reading that question verbatim. That's not my question.
Well, just as an aside, the medical school, one of our classmates, we said it was something from GSD, glycogen storage disease, because it was not. No, that's not true.
What about the atrophy of disuse? You know, there's a myth that goes around that people who are, and I want you to speak into this as well. If you are not very sexually active, or if you're not sexually active enough, or you're not sexually active at an early age, is there any harm that can come to you, or is there any advantage to that at all?
No, there's no harm that can come to you. The first house in town is never the best house. As long as when you finally get started, you do the right things, you are physically fit, you look after yourself, and you read about it. Because some people, for example, who are spiritually inclined, they save themselves from marriage, which is fantastic. But when you've done that, you need to read about it. How do I, look after my partner? How do I sexually stimulate him or her? You learn about it and all that. So when you do that, you can self-teach and then become a star. It doesn't matter when you start, as long as when you finally start, you do it right and do it well.
Okay, that's very interesting. We've got only a few more minutes, and I've got 1 or 2 hands raised up. Chukwuemeka, you've got your hand raised up. We've got 1 or 2 minutes. You've got the floor. You have to unmute yourself, sir. Chukwuemeka, do we have you on? I think it's frozen.
Yeah, I'm here. I'm here.
All right, please go for it.
Yes, I was the one who asked that question about sperm accumulating in the body. So why I asked that question is this. I have a friend who he isn't sexually active for more than 4 years actually, and then he's been having series of problems in the body, and then he went to the hospital. This happened in Cyprus. He went to the hospital. The doctors conducted all the checks. They said there's nothing wrong with him, and then they said, "Do you have a girlfriend?" He said, "No, he doesn't have a girlfriend." He said the doctor told him, "Go get yourself a girlfriend." So I was asked that question.
Right.
Yeah.
That's very interesting.
Thank you.
Okay, so yeah, I mean, so just as we round off, Chukwuemeka's question confirms a few of the things you said earlier on today. And one of the things I said, there's a lot of myths and misinformation on the internet. And I think it's really important that we all go to the right sources to get the right information. Don't assume that you can just get information from anywhere. A couple of last words or take-home message for us today, Dr. Hector.
I think I just saw my mentor in life. I just said Emeritus Professor Nimi Briggs, a former Vice Chancellor, former everything. I just saw him in the crowd in the group. I want to say thanks, Prof, for making it to today's session. And I just want to say finally, anyway, that 2 things here. One is your brain can have a massive effect on erectile function. So make sure that your brain is happy from the time you mentioned. And then your blood vessels and your nerves are where erectile function takes place. So protect your blood vessels, particularly by making sure that you have a healthy lifestyle.
Brilliant. Thank you so much, Dr. Abiye Hector-Goma, for a very brilliant and educational session. I really appreciate you taking the time to come and speak to us today. And Hector's slides will be available to anyone who wants it. All you need to do is email us at health@CAHN.org and you will be sent these slides. It's really important. If you have any further questions, I think one of these days we should have a session on premature ejaculation, delayed ejaculation, sexual health, and really perhaps dig into that. But if you have any further questions, please do email us in CAHN and we will be able to accommodate that. Thank you so much for everybody who has logged on today. It has really been a brilliant session. Really, I learned a lot. Don't forget the website that Hector mentioned if you want to evaluate yourself, or if you have a friend or a partner who needs to be evaluated for erectile dysfunction. It's IIEF, I believe.
Yes, IIEF-5.
IIEF-5. You can do I've had a quick look at it while we were on the session. It's really brilliant. It's simple to use. Don't forget that counseling is available free of charge here at CAHN. Just email or get in contact with us and our counselors will be on hand to speak to you. Next week, we have a fantastic session, another fantastic session coming up on physical and mental health in early pregnancy and its complications. We have one of our lovely gynecology colleagues who will be coming to speak to us and she will be talking to us about physical and mental health in early pregnancy and also its complications. Thank you so much to everyone for joining the session today. I'm going to hand over to one of our admin, James, who will close the session. Thank you.
Thanks, Dr. Joe, and thanks again to Dr. Hector-Goma. Really, kind of interesting conversation, and just to reiterate some of those, points that Dr. Joe made. Yeah, really interesting to dispel some of those myths and talk about some of those myths. I'm glad, that we're able to have this conversation, and hopefully, kind of people that have attended will take those things on and discuss with their friends and family and colleagues in the future. Now, if you just bear with me 1 second, we've had a couple of technical difficulties this morning in closing the session. So I'm just going to share my screen, and hopefully this will come through relatively quickly. I just wondered if somebody will be able to just let me know whether they can see my screen.
Yes, we can.
Thank you, Dr. Hector-Goma. Okay, so as Dr. Joe mentioned, next week we have our session on at the same time, 11 till 12:15, and that session is on early pregnancy and issues around early pregnancy. So to register, please, drop an email to events@CAHN.org.uk. Please pass the word around. Check our socials for the link, either through Zoom or through YouTube, please. Excuse me 1 second. I'm just struggling with the slides. On Tuesdays, we have our regular healthy heart sessions from 6 till 7:30. The topic this week is groceries and shopping. We have some excellent guest speakers that are going to come and talk to you about nutrition and how to be able to eat healthily, and kind of adopt that healthy lifestyle that we talked about and discussed as some of those contributing factors today. So again, please, if you would like to register for the event, just drop an email down to events@CAHN.org.uk. And again, all of the details and the links for these events can be found on our social. So please go along, follow CAHN, check out the links. Please retweet and share them among your friends and family, and spread the word about these resources. Again, that's 6 till 7:30 every Tuesday, our healthy heart sessions. Excuse me. Some of you may be aware a couple of times over the last few weeks that we've mentioned that we're in the process of trying to raise funds for our advocacy and domestic violence service that's run by an incredibly dedicated group of people. There's amazing impact, particularly at this time where everybody's under extra pressure with the cost of living. We're doing this in association with an organisation called Crowdfunder, and we've been very lucky to be able to get hold of some excellent match funding from. So we'd like to appeal to everybody just to pass on and make people aware that we're raising funds. Our target is to get to £20,000 of funding to support the service, and that will be matched with 20,000. If we reach that target, that'll be matched with £20,000 worth of funding from the insurance company as well. So please, if you consider giving in the next few weeks, please consider this appeal. And if you're not able to, please just try and share the appeal and kind of raise awareness of what we're trying to do there. There's also different types of rewards that we're offering as a part of the campaign. So it's not just a one-way street, there's something to get back from it as well. Please, if you can, share. Thank you. Wanted to raise awareness of our upcoming International Women's Day, which is obviously on the 8th of March. We're going to share full details via our website, so you can go to www.CAHN.org.uk, or again, kind of follow us and share share the details of the day via Twitter or Instagram. We're also on Facebook as well. If you would like to talk to us about sponsorship or becoming a partner for one of our major events, including the International Women's Day, please reach out and get in touch at info@CAHN.org.uk. as I mentioned, and as Dr. Joe mentioned within the presentation, we have people constantly available there for you to speak to about any of the issues that you may be facing around your health or mental health. Please do contact us and our support team, particularly our advocacy service. They're open 9 a.m. till 9 p.m. every day, and the telephone number to contact them on is 077 10 022 382, or again you can email help@cahn.org.uk. Just finally then, just mentioning our partners. We, the Caribbean Health Network, are always available for to be contacted. Please visit our website to check out the information on our programs and the various bits and pieces of work that we're doing across the country. That's at www.cahn.org.uk. Our telephone number, if you want to reach out in that way, is 07385 608328. And of course, you can always contact our communications team and our lead Lander on the email listed there. Quick mention for one of our partners in these Health Hour sessions, RAFA International Development Agency. Again, you can see the admin@rafa.org.uk as the contact email if you'd like to get in touch with them. The Royal Assembly Redeemed Christian Church of God, Dr. Samuel is the contact there, and the telephone number for him is 07882 931 539. Our excellent colleagues at the BME Forum are another contact and partner for this for these health hours. Please do get in touch with them if you feel the need to. 0208 684 3719, and of course Black Health Initiative, an amazing organisation. Telephone number for them 0113 307 0300. And that wraps up our session for this week. So again, we'll look forward to you joining us on Tuesday evening, and of course next week on that early pregnancy session. But for now, from everyone from the CAHN team, thanks once again to Dr. Joe and Dr. Hector for another kind of really exciting, kind of expansive and information rich session. Thanks everybody. See you all next week. Take care.
To meet I need to use the time to listen. To request at CAHN.org.uk.